My name is Tasha, and today I'm going to be recording my leadership job interview. I'm going to be interviewing for a unit manager position.
Hi, Tasha. Nice to meet you today.
Nice to meet you.
I appreciate you coming in today. So can we start the interview and I'll go over a few questions with you?
Yes, please. Thank you for having me.
Of course. So what is your leadership style? Can you give me a few examples of this in action?
Yes, perfect. I would say that my leadership style is a kind of a mixture of maybe transformational and a servant style of leadership. I do believe in leading by example. I think it's important that we empower your team. I believe in a supportive environment that would encourage growth and collaboration. I would say an example would be in my current role, I would implement a peer mentorship program. I do have experienced staff members, which we have them guide the new employees because it helps foster the culture of teamwork and professional development. This helps improve the staff retention and confidence among our new hires.
Thank you. Tell me about a time when you faced conflict or disagreed with a coworker or a leader.
Yes, of course. In my previous role, a disagreement arose regarding patient care priorities during a shift change. One of my colleagues wanted to delay wound care for a patient, and that was due to time constraints, but I did let them know that the importance of timely intervention. I did address the concern by calmly letting my coworker know that the patient's needs, by letting them know evidence-based practice and collaborating to adjust assignments so that we could prioritize both efficiency and the patient's well-being. By doing this, it helped resolve the conflict between both of us because we wanted to ensure the quality of the patient care.
Tell me about a time when you were faced with a problem and successfully solved it.
Yeah, so during a shift, a sudden influx of high acuity patients had placed a strain on the resources that we had. By recognizing the challenge, I did quickly assess the staff capabilities. I did reassign roles to make sure that we ensured efficient care to our patients. I also communicated with the leadership to request additional support because we need to make sure that we have people to help us on the floor. Of course, by being proactive with my problem-solving skills, it minimized the patient wait times and prevented my staff from burning out.
All right. Tell me about a time you faced a staffing shortage, either from a leadership or an employee situation. What were your actions related to being understaffed?
Yeah. So on a busy weekend, we were unexpectedly short-staffed due to a lot of call-outs. I did swiftly assess the situation and prioritize the patient care tasks and distributed the workload among the available team members that I had. I did also reach out to our float staff and cross-trained the staff that we did help have where they were needed throughout the unit. I also ensured that the staff breaks were managed so that our team could have some breaks because they were getting exhausted. The quick thinking helped the team maintain patient care standards even though we had a shortage.
Great. What is your strategy to retain employee and maintain morale on the unit?
Employee retention and morale are tied to job satisfaction in the work environment. I like to focus on having professional development, recognition, and making sure that my employees have a work-life balance. It's very important. I like to have regular team meetings so that my staff can talk about the concerns and advocate for needs that they have. I also like to do recognition programs like having Employee of the Month. I think it's important that they have growth opportunities and continued education and leadership training.
How do you offer feedback to your employees?
I like to use a balanced approach, making sure that there's constructive feedback with positive reinforcement. I do follow a situation behavior impact model, which is like a feedback specific solution focused strategy. So if an employee struggles with time management, I'll provide coaching while knowing their strengths and offering strategies that can help them work on that.
Give an example of how you embrace cultural differences and diversity within your team.
In my current role, I like to implement cultural competence training so that we can enhance awareness and inclusivity among our staff. I do like to encourage open discussions about the diverse healthcare practices. We want our team to respect and accommodate all the patients' cultural preferences. This has helped strengthen the team dynamics, and it does improve our patients' satisfaction overall.
How would you approach an underperforming employee?
I would first assess what's causing the performance issue. Once I do that, I would use the coaching approach. So I would want to set the clear expectations, providing additional training if needed. I would also follow up with that person regularly. If performance doesn't improve, I would escalate from the formal performance and improvement plans while maintaining a supportive approach.
How would you approach an angry client?
You always want to remain calm with somebody who's already angry. You want to be empathetic, listen to them. They always want to be heard, and always want to have a solution. Acknowledge their frustration. You want to reassure them and let them know that their issue is going to be addressed. I would take appropriate action, whether resolving the problem myself or maybe escalating it to the department that they're looking for. It does help to de-escalate the tension, and it does develop trust with that client.
How do you commit to professional development? Provide an example for me, please.
You want to stay updated on any evidence-based practices through any continuing education certifications. You want to attend any nursing leadership workshops. Like myself, I like to complete any leadership development courses that I can, because I like to constantly enhance my skills in any staff management and process my improvement, which I will apply to any of my roles that I have.
All right. What would you do if you were presented with a process improvement project with ambiguous directions?
I would start by gathering any available information and consulting with any of the relevant stakeholders for any clarity. If any ambiguous remains, I would use any evidence-based practice and team input to develop structured approach. I would then pilot the process, assess its effectiveness, and adjust as needed based on data and feedback.
Thank you so much for conducting this interview today with me.
Perfect. I appreciate you having me today. Thank you.
Of course, you're very welcome.